then we can have a discussion about possible funding sources. I'm still working on the substitute, but should have something I can share tomorrow, and we can dig into the substitute tomorrow, and you can provide feedback. So we'll start, Councilwoman Stiles. I know there were a couple of items that you added to your wish list, so if you want to talk about those.
Thank you very much. Chair, is it possible if I could allow Councilmember Sepulveda? She said she had an announcement.
Oh,
She'd
that's
asked you to
right.
make.
My apologies, Councilwoman Sepulveda. Go ahead.
Thank you, Chair. For those who are present and need translation services in Spanish, I will be here the entire meeting. So if you need that, I'm happy to sit with y'all in the back. If anyone watching in the public online wants to come down and also requires those translation services, you are more than welcome to come at any time. I'll be here until we try and figure out another solution through the council office and the mayor's office. Thank you, Chair.
Thank you, Councilwoman. Councilwoman Stiles.
Thank you very much, Chair. So yes, there are 3 positions for animal control. 2 are for the officers going to do the assessments, and 1 is a kennel assistant. In that, there is a need for two vans. So the total cost is 102, 645 for the 2 animal control officers. The kennel assistant is 43,157, and the vehicles are 100,000. Then there was also a translation service for the council office. So that's in the amount of 55,000. And that would cover for Spanish and for Arabic translations.
So in terms of the additional FTEs for animal control, the numbers that you gave, does that include fringe?
Yes.
Okay. Any conversation on the additional FTEs for animal control? Councilwoman Johnston?
So the translation thing, that's not for animal control, though. That's
No.
Okay. So I have a question about that when we get there.
Okay. So were these FTEs included in the budget request? Like how did these additional FTEs come about?
They came about through a conversation that I had with a current officer in regards to being able to respond to the amount of calls that are coming in and repeated visits that take place for every call. It's not just one visit, it's multiples. And so that's what's creating the backlog. So in asking.
So did you have a conversation with the department head? Okay.
Yes, I did.
Okay. Any other questions? Now this big screen is in my way. Okay, moving on to the translation services, and that would be services housed within the council office. What would they be for?
Yes, housed within the council office, that would be any needs if we had something that we wanted to distribute to constituents and we needed a translation service. Right now, I think we're all scrambling to try and find people to piecemeal things together. This would be very helpful. I know not all the districts have a need for all of the translation services, but I think certainly at least Spanish is needed across the board.
So it would be a service that all council members could use, or would it just be for like council-wide functions?
It would be for all council members to be able to use.
Councilwoman Johnston?
I don't see that being a full-time need. Is it possible that there would be a service like through Conexión Americas or through Hispanic Family Foundation, that we could have an agreement with them that they would help us with stuff like that. I know that Diane would probably be really open to that. And if we had to, but I don't understand a full-time employee. I feel like they'd be not utilized as much as they possibly, as much as a full-time employee should be.
And Councilwoman Styles, is this a position or is this the cost of services, like with a company?
Thank you, Chair. It actually is cost of services, not a full-time employee that would be responsible for responding to all of us.
Councilwoman Porterfield and then Councilwoman Sepulveda. Oh, sorry.
Thank you, Madam Chair, and thank you, Councilmember Styles. I think that is a great suggestion. I just had a clarifying question. Would this person, be available to, translate documents? So when we're sending like newsletters out to our district, would they be able to provide that type of service? That's the first question. And then the second question is, would they be available to offer translation services during meetings so that the public can participate as well? And if so, do we have any information on like what that would look like or logistics, or is that still being ironed out?
Councilwoman Styles.
Thank you, Madam Chair. If I may respond to Councilmember Porterfield's question, yes, services would be for translation. They are cost per word. And then also those services, the intention is that they would be available to participate in activities like this, but perhaps if someone had a community meeting and had a need, that we'd be able to utilize them as well. And there's a cost per hour on that service. And I can share that graph.
And Director Cooper, how would that work if there was money in the council budget for translation services? Would there be a standing contract, or the council office, at the request of a council member or whatever, would just reach out to a translation service?
If Metro doesn't have an existing contract with a translation service, then we would have to procure it through Metro procurement, and just have one contract for that purpose.
Okay. Councilwoman Sepulveda.
Thank you, Chair. I think I see Mike Jameson in the front. Yes, it's hard to see with all the glass. Can he speak briefly to the two contracts that were forwarded over to me and the Vice Mayor today?
Just to briefly recap, at the previous council meeting, you may have heard that there was a shout out from someone when the Vice Mayor was announcing the work session, if that would be translated and for multiple language needs. So a group of council members convened after that meeting to request what could be put together in that 36-hour time frame. We do have an existing contract through a company called Voyance that provides a variety of services. There's an additional fee per need. The ultimate holder of that is the MHRC, the Metro Human Relations Commission, and Melody Fowler Green was in contact with their service providers. At the ensuing work session on Thursday, it was essentially too late for them to come prepared because there's an equipment need. In other words, rather than someone at a simultaneous translation service, rather than someone conveying to the individuals in their dialect at the same time, which can cause some confusion, they typically speak through a microphone system into headsets for those that need the services. We also contacted the interpretive services for the state trial courts and general sessions courts, which provide it, and Ms. Christina Frazier for the state trial courts interpretive services did come here Thursday. There just didn't happen to be anyone that needed the translation service in the public viewing sector. She is interested in participating with the council on further endeavors to look at sort of a more comprehensive approach with just a little bit more time. She might even be here today, for all I know. She's volunteered to come here on subsequent dates, and that's essentially where we've left it. There have been other service providers on sort of a case-by-case basis, and that is information within a single link that I can forward to council members. But I think it's a worthwhile effort, just with sufficient time dedicated to it so that we're ready at the drop of a hat the next time.
Thank you. I just want to commend Councilwoman Stiles' efforts. I think this is very much needed. I would go even further and say that we do need a staffer. There's many cities our size who do have staffers who provide translation services. And I think, if I'm not mistaken, the Hispanic population is around 15% in this city. I'm able to translate my newsletter because I'm a native Spanish speaker. I know that there's other council members who would love help. I know that many times I'm the one that gets called whenever there are evictions happening across the cities, and then I connect those people with their council members and offer my services to those council members to see if they need me to help translate between them and their constituents. I think there are issues happening every day, and I am only one person, and I know that we need this very much. You know, at the last budget meeting, we had someone say that they would like Spanish translation at the last public hearing. At this public hearing this year, we also had some people come and say that they needed Spanish interpretation. And I think that people have this idea that maybe we don't need Spanish translation or Kurdish translation or ASL translation because they don't see those people in the audience. Well, maybe they're not in the audience because we haven't been communicating in a way that they understand, and maybe we could have more community input when we provide these services. I don't think it's ever a bad thing to have more people from diverse backgrounds be able to participate in their local governments since they are also paying for taxes. So I stand in support of Councilwoman Stiles' efforts. Thank you, Chair.
Councilwoman Suara.
Thank you, Chair. I just want to speak in support as well. I've always said that there's a lack of trust in government because there's not enough communication. And I think the more that we're able to communicate to our residents, the better we can explain what we're doing and how we're doing it. The fact that we're leaving about 15 to 20% of our population out is a big number. And not just Spanish. Spanish is a big one, but I know that even during the COVID testing and training, we had to do a whole lot with AMAC to get some of those translated and some other organizations. So I speak in support. I don't know what form or fashion it would take, whether we want to just have services, but we need to put it in the budget and to be able to say that anytime we have major information going out, that we will be translating those into the languages that we have in the city. So I do speak in support. Thank you.
Any additional comments, questions, concerns about the translation services? All right, seeing none. Councilwoman Porterfield, did you have fire and EMS as part of your wish list? Because we didn't talk about that the last time.
Thank you, Madam Chair. I did have the request for additional personnel in that particular wish list. I think we've heard for the last few years that it's a safety concern when the fire trucks are rolling out with 3 individuals, when I think it's the industry standards have 4 people per truck, and many times they're having to dispatch more than one piece of equipment out because they don't have enough individuals to maintain, to help address some of the calls that they're getting. They're having to use multiple pieces of equipment to try to make sure that they're keeping everybody safe. And this is something I think fire's been asking for the last few years. I know that there are also some concerns around equipment as well. So I believe that there's a huge need for additional equipment. I know the fire hall in my district, I speak with them, and they're just amazing, and they have wonderful things to say about the department, but it's very discouraging when I'm out there and I see that their trucks are being held together by gray duct tape. And I think we could do better as a city, and we need to make sure that we are supporting the people that are putting their lives on the line every day to help keep us safe. So with that, Madam Chair, I know that there may be a discrepancy between funding, whether or not we're going to be able to get them more employees or if we're going to be able to get them more equipment. I think both of those requests are just dire need.
You too. Councilwoman Stiles.
Thank you, Madam Chair. I just want to speak in agreement. I think it's been very concerning to know that we've been understaffed for emergency services, and sending firefighters out understaffed is unfair and setting ourselves up for a bad situation. So I commend Councilwoman Porterfield for bringing it up. I do think that we need to do both rather than doing one or the other. Thank you.
Hey, Councilwoman Porterfield, did you have a specific number of FTEs or equipment requests for fire and EMS? 'Cause I know they did receive a significant increase in the number of FTEs in the mayor's proposed budget.
I pulled it from the hearing, from the fire hearing, Madam Chair, and I apologize. I'm trying to get into the document, and I cannot get into it. I believe it may have been 40 individuals between fire and EMS, but my apologies. I don't have it up in front of me. If we want to loop back to it, or I can get it and send it through the council staff and get it to you, if that's okay.
That's fine. And also any equipment needs that go along with adding those FTEs.
Will do. Thank you, Chair.
Councilwoman Stiles and Councilwoman Suara. Did you? I thought I saw your hand. Sorry. Councilwoman Suara.
Thank you, Chair. I just want to speak to that national code that Councilmember Porterfield referenced. I remember that in one of our minutes in the audit committee, there was a statement to that effect in terms of are we really complying with that requirement. And I think that if there is a national standard, not that we're not in compliance, I think that we could do better, because I don't want to use the wrong word, but we recommended is that number of FTE, and I think we need to make sure that we're doing that. So, thanks.
Councilwoman Porterfield.
Thank you, Madam Chair. I do have the wish list pulled up. It's 5.5 million was the amount that was referenced that would be needed for staffing for fire and EMS. So I'm not sure of the exact number of FTEs, but the total amount was 5.5, and I can get the equipment request as well for you.
Okay. Any additional comments, questions, concerns? All right, moving on. There were 2 FTE requests for the county clerk's office. The county clerk's office lost a couple of positions maybe a couple of years ago, and the total for that to restore those 2 positions is $128,700. Any comments, questions, concerns about that item? Oh, sorry. Councilwoman Gamble.
Yes, I would just like to speak in support of that. I spoke at our last budget workshop on Thursday about the need for these 2 positions. Of course, that office services the public, providing marriage licenses, vehicle registration, and tag renewals. And every time I go by the Howard School, there's a line. So they really do need these 2 positions, and hopefully we can look at restoring them since they were cut last year, I believe it was, with the budget cut. So thank you.
Thank you, Councilwoman. Any other additional comments, questions, concerns? All right, seeing none. During the MMPD budget hearing, the mental health co-op passed out a flyer that outlined that even with the proposed allocation in the mayor's budget, that they still had a $950,000 deficit. I reached out to the leadership at the mental health co-op, and they confirmed that that deficit is actually $818,000. And so, in my opinion, it makes sense to make sure that the entity that is doing the co-response pilot with the city is fully funded. Are there any comments, questions, or concerns about that? Councilwoman Suara?
Thank you, Chair. I had my budget conversation this last Saturday, and it was on the cost of public safety with representatives from the police department and the people's budget and some other folks. But what was interesting in that conversation is that everyone on that panel agreed that the mental health part is the most important thing that we get to do. And each side also agreed that it does not have to be either or, because there's a need for the co-op option, which is the one through MMPD, that focuses on people that are very violent and need to have a place there. But there's also the need for those part of our citizens that are triggered by police. They're not violent, and actually seeing a police officer come around to them could also be a trigger. And so what both sides is recommending, and what I hope we'll be able to do, is fund both. So I'm speaking in support of that co-op, the 800,000. I'm also speaking in support of EELS, which is the other option that is on the table, because it's just, and if you did not watch it, please go back and listen to it. It was very detailed, and I think as we look into public safety and things that we need to be doing differently, the mental health component is very big, and those two programs are very essential. Thank you.
Councilwoman Johnston?
Thank you. Have we talked to MMPD? I know we just got the press release where the training is just now starting for that co-op between. So have we talked to them about the possibility of running those two programs at the same time, or would it be prudent to see how this pilot works and, see what benefit that has? I'm assuming that it will, and fund that. I get that. I'm not saying we do need funding to the mental health, social services, 100%. That's a super need. I'm just worried about funding both and without seeing what's working in the beginning, with what we've already started.
Councilwoman Porterfield, then Councilman Nash.
Thank you, Madam Chair. I think I spoke last week on it. I also support running both models concurrently. And if I may address Councilmember Johnson's question, I have spoken with MMPD about running both models, in which they said that they were willing to run both models. I think there has to be some logistics to figure out what exactly that would look like. I did listen into Councilmember Suara's budgeting conversation on this past Saturday. And I think one thing, there was a mental health professional who was very adamant about the services that are needed, and the co-response model that Nashville is looking at, it heavily mirrors the model in Denver, and the model in Denver does run, there is a spectrum of services, so it's not just co-response or Cahoots. Cahoots is the model that the HEALS model is based off of. It's not a either or, it's a both and type situation. So we could run a model in which it is tiered, and if an individual, if there is an individual there with a weapon, or if the people that are calling in are saying that, the person who's in crisis may be behaving erratically and possibly violently, that may be a call for a co-response where an officer also responds. But if a person is in crisis and there is no threat of violence on that particular call, those may be the calls in which it's only a mental health provider that is responding to those calls. But to directly answer that question, I know I personally have spoken with MMPD, who said that they would be willing to run both models.
And I'll say that there is a ongoing conversation with the mental health cooperative, because they would be the entity implementing both models, and to see whether or not they're willing to do so. Councilman Nash, then I'm gonna hit Pulley, then Stiles.
I share Council Lady Johnston's concerns for a couple of reasons. There's a limited amount of resources that the police department, and I think to try and start up one project is kind of enough to juggle with when we first start out. Now, I do agree that the potential for the HEALS type program is there and probably a good resource to have, but I think we're going to need a little more time to also address that issue. Number one, staffing of it from the mental health co-op standpoint and training of the dispatchers. I know I used to tell my people, take what you get from the dispatcher with a little bit of a grain of salt, because they are not on the scene. They're getting all this information from a third party, and I can tell you many times when somebody said, no, they're not armed, you'd get there, and sure enough, they were armed, or you'd get an indication that they were armed, and you get there, and they weren't. So this is going to take a little extra training on the part of our emergency communications people to kind of sort through some of those issues and make sure that we do keep the responders safe. And I think that may be something we could do this year and then maybe work towards an implementation come next budget year. I think would probably be the more prudent way to implement something like that.
Councilman Pulley.
Thank you, Madam Chair. I also spoke with the police department. I went directly to the police inspector who is running the Partners in Care program, which is being run in conjunction with the Behavioral Health and Wellness Advisory Council and Mental Health Co-op, and talked to him at length about that program. I also think and I'll tell you the results of that conversation after I make this point. I also think it's very important that we understand that we just got through going through a process where the community and the mayor's office went through a very diligent and long process where we hired a new police chief. And at the same time that was going on, the mayor's office put together a 40-member policing policy commission. And this was a broad spectrum of not only experts but community members who came together to participate in a significant number of meetings to arrive at policing policy recommendations, which were presented to all of the applicants, to include Chief Drake, to let them know what the community wanted in their policing. There were 2 council members who were also represented on this policing policy commission, and one of the recommendations among many, which Chief Drake took into account and began to work on, was this model of Partners in Care. When I spoke with the police department about this, they did indicate that in the future they would be willing to certainly entertain the model of that was being presented, very similar to HEALS or CAHOOTS. But currently, I think it's important to note that this Partners in Care program is a pilot. They are training a number of mental health professionals to work alongside the police. And they are, at this point in time, the people they're working with do not feel comfortable going out there on their own. And I certainly would, and we've got the mayor's office policy arm here with us, policing policy arm with us today, but my understanding is a review of the data shows that less than 4% of the calls are those that could be responded to without police. So I certainly think it's prudent for us to move forward with our current pilot program with the thought of potentially incorporating something like this HEALS model down the road. But I think currently we should stay the course where we are. Thank you, Madam Chair.
Councilwoman Stiles.
Thank you, Madam Chair. I do want to speak in favor of the co-response. I believe it's important that we are making sure that everyone feels safe and that people are not triggered. But also, if we send people out to a call and you arrive and someone is violent and we only have 2 mental health professionals, they aren't adequately equipped to deal with that situation, and we waste valuable time and then having to call the police to get someone on site. So I think it is the most prudent application for us to have a co-response. Thank you.
Councilwoman Porterfield.
Thank you so much, Madam Chair. I would implore my colleagues to please look at the data. Cities have been using these models around the country, and while we all have personal opinions on what would be the most prudent way to utilize this, there's tons of data that support the models of both co-response models as well as the Cahoots or HEALS models that do not have armed officers. I said it last week, I'll say it again this week. If I'm sick, call a doctor. If I'm sick, please don't call a police officer to come and help me, because that is not their job. We need mental health professionals to help people that are in mental health crisis. The same argument can be made if we have an armed officer on a site and an armed officer is not needed. That is taking an armed officer off the streets that could have been helping on a robbery or a murder or domestic violence call or anything else that an armed officer would be needed for. An armed officer is not always needed when a person is in mental health crisis. So again, I implore my colleagues to please look at the data when looking at these two programs. Thank you, Chair.
Councilman Nash, then Councilwoman Suara.
Just briefly, when police officers respond to mental health crisis, we're not pretending to doctor those people. They get taken to the mental health co-op or to Vanderbilt Hospital for evaluation. We're more like the ambulance driver in those cases. We're not pretending to be mental health experts. We've got a minimum amount of training to help us get the person under control and to a facility where they can be treated.
Councilwoman Suara.
Thank you, Chair. I don't see it as either or. I think there is the program put together by the police is very much needed. And the way Deputy Chief Taylor explained it, and when you're talking about situations where it's very volatile and you don't want people that are not trained to be there. So you do need that program, and I'm in support of it. But I do know there are situations where it does not call for calling for a police. I've had a situation where a young lady had a meltdown, and we're dealing with her and we didn't know what to do. Having the ILS program, having a place to call outside of the police that can deal with somebody like that is not violent, but it's just that someone like me don't know what to do with it. It's an option. It's an option. And these other program would not be housed in the police department, so it does not have to be a police department program. And so that's what I'm saying, that if we can, and we should, because we need to deal with all of it. We don't want a situation when we're sending non-police to situations that are volatile. At the same time, we don't need to sell police to where we don't need to send them to. So if we're talking about 800 here, 1.6, I don't think that's too expensive for what we need to do for different segments of our community and the different needs that come with that. So thank you.
Councilwoman Sepulveda.
Thank you, Chair. I just want to say I support funding the HEALS program as well. I agree with Councilwoman Suara that it doesn't need to be either or. I think for a long time, we haven't been funding, mental health the way it needs to. And I know that there are many people in the city that don't have insurance. And we have even heard from the sheriff's department where a lot of people end up arrested because there are no other options. I think that this program has been shown to work in other cities, and to Councilmember Nash's point, a lot of these officers aren't trained and equipped to deal with mental health crisis. So I think that's more than enough reason to fund programs that will be helpful to the community. And at this last budget hearing, that is something that came up quite often. And so I would implore my colleagues to, listen to what a big chunk of the community is asking for.
Councilman Pulley and then Councilman Cash.
Thank you, Madam Chair. Again, I would say that let's remember that Partners in Care, which is a program that Metro is undertaking right now, does have a co-response with mental health professionals. So mental health professionals will be deployed with police during these cases. And again, the data reflects that less than 4% of the calls for service would be the type of calls for service that would not really require a police officer to respond. And this is a pilot program. I think it's important for us to walk through this pilot program and allow that to show us what kind of data comes from this program. Neither the police department or members arguing for this program are opposed to both of these, and I think it's important for us to take this program, walk it through, see what the data is, and it's very possible that we could end up employing both programs in the future. I would say let's I certainly am supportive of running the program that we have now, seeing what data it provides us, and then moving forward once we see how effective this is. Thank you, Madam Chair.
Councilman Cash.
Thank you. I'm in support of trying this, and at this point we're talking about a 1-year commitment. Is that right? Not necessarily a 3-year.
Correct.
Okay. I kind of like to understand this 4% that the councilman referred to, and I don't know that we ever expected the kind of calls that we're talking about to be a huge majority of them or anything like that. 4% doesn't, if we can think about how to address these 4% of our police calls and do them a little differently, I think that's fine and appropriate. I'm all for collecting data, but if we're only collecting data on one of the programs now, but do believe that both programs could be, employed in the future, then let's go ahead and start trying the second program and collecting data on it so we can put them side by side and make educated decisions about both programs. Thanks.
Councilwoman Porterfield.
That was, Councilman Cash just said what I was going to say, so I put my hand down. Thank you, Chair.
Councilwoman Sepulveda.
Thank you, Chair. Just for clarification, Council Member Foley, where's the data coming from? And was it gathered in the group that the mayor's office put together?
We have the mayor's office here, and one of the policy individuals, Mr. Bunton, can speak to that.
Thank you, council members. The Policing Policy Commission and the Mayor's Behavioral Health Wellness Advisory Committee both work closely with the Mental Health Co-op, the police department, and other agencies and departments, and engaged in conversations with nonprofits. And the approach that they came up with was the co-response model based on the Denver STAR program that MMPD and other departments are moving ahead with and plan to start fielding later this month. That has been their focus, and from my conversations with Inspector Emhoff, the preference has been to start by focusing on co-response. There is a possibility to add on to the Denver model another option, the STAR option. I agree with council members who've expressed the belief that talking with Mental Health Co-op and connecting with Inspector Emhoff on capacity is very important here. But there's a clear focus from both and recommendations from both the Policing Policy Commission and BWAC to start by focusing on the current co-response model. Thank you.
Councilwoman Sepulveda.
Thank you. Sorry, Mr. Budden, can you tell us where the 4% came from? What data, who collected it, and what qualified it as a mental health response? Thank you.
Absolutely, Council Lady. So there are really two high-quality sources of data about the percentage of calls involving people experiencing a mental health crisis and what percentage could be responded to without police officers. The Council on Criminal Justice issued a briefing last week, which draws on research conducted by George Mason University. I'd be happy to share that with anyone. And that produced the less than 4% of calls to 911 centers involving people in mental health crisis would be suitable for a non-police response. More recently, Denver actually did an assessment of the STAR program. I'd actually be happy to share that with anyone as well. What that program is in practice is a two-person team, a clinician and EMT, who work weekdays from 10 to 6 a.m., and what Denver found was approximately 2.8% of calls in Denver to 911 involving people in mental health crisis were suitable for a STAR-only response. So it is a small percentage of overall responses based on national data that we have and specifically on Denver's data. And anyone who would like me to share those research briefs with you, I would be happy to do so. I'll follow up with everyone who's spoken up in this debate to provide that information.
Any other questions, comments, concerns? Councilwoman Allen?
Thank you. If we could just clarify, if you'll follow up with Councilmember Toombs and she can get that information to all of us, because I think we'd all like to hear it. Thank you very much.
Any additional comments, questions, concerns? All right, seeing none, there was one item that I just wanted to put forth to the group because I had not seen it in anyone's wish list, and that was in terms of affordable housing. I know Councilwoman Suara has been doing her budget series, and that's been a topic of conversation. So I just wanted to make sure I had not missed something in that there was some desire to do something additional outside of the mayor's proposed budget. And Councilwoman Suara, for the viewing audience, would you like to go over what we already have in the proposed budget?
Thank you, Chair. I will sign up to put any additional money in affordable housing any day. So yes, please, let's do it. But so far, I think there's a misconception that there's only 12.5 million in affordable housing. And I think that's the number that a lot of people are using, but it is a little bit more than that. If you listen to the mayor's Metro address, in addition to the 12.5 million, there's a 10 million that the mayor is proposing to add to bonds fund from the America Rescue Plan fund that we get. There's also another 10 million that is also proposing to use as a catalyst fund, which is also for affordable housing. So that makes it about 32 right there. The mayor also has it on there that we have a piece of property in District 2 that we're looking into getting an RFP and making into affordable housing. We're also adding 2 FTEs to the housing department to make sure that anything relating to affordable housing is taken care of. And I believe that there's also $2 million in our capital funding that relates to housing infrastructure. So when you put all of that together, you're talking about 35 million in affordable housing. And so I thought it's good to clear that up, but it is not enough. And so if there's opportunity to do more, I would like to build on what Councilmember Droffel had the last hearing that has to do with homeless housing. And that's an area that I would love to be able to put a wish list together somewhere there. Because we know we have a problem with homelessness. We know that arresting people and doing all of that does not solve it. And we need to find a way to house them. And so that's an area that I would love a wish list to be able to do something. But I want to clarify that it's more than 12.5 million already in affordable housing. I think it's good for us to be able to put that out there.
And what we discussed at the last session, there was a discussion of adding those two FTEs for social services for the homeless division, and then there was discussion that the actual housing portion was more of a capital expenditure, like building housing. So that wouldn't come out of the operating budget. Any additional questions, comments, concerns around affordable housing? Councilwoman Allen.
Thank you. I'll just add real briefly that there also is somewhere around $2 to $2.5 million for the HIP program, Housing Incentive Pilot Program, as well as ongoing money for pilots for low-income housing tax credits that continue from year to year. So that's not new stuff, but it's continuing existing programs that is in this budget. So if we've got more there, then let's add it. But I appreciate you pointing out what we do have, and I appreciate the mayor putting that much in there.
And the mayor actually just left the room. I didn't notice he was in the room. Any additional comments, questions, concerns around affordable housing? All right, seeing none, two things that we're going to do next is one, I've invited folks from HR. I know we have Mike Taylor, and forgive me, I've forgotten the other person's name, but Shannon Hall couldn't be here, and she has sent two excellent folks in her stead to talk about the pay plan. There's been a lot of discussion about the amendments, the civil service amendments to the pay plan that was proposed. And in addition to the pay plan, I wanted to have some discussion about the 4% fund, because that's probably a recurring theme in everyone's wish list to reduce the 4% fund. So I wanted to to provide the opportunity so that council members can know why the amount that's in the proposed mayor's budget is in that 4% fund, and Kristen Wilson is going to go over that. But if we can start with the pay plan, and Mike, who I've never met in person, I don't know what he looks like. And you can come up to the front, because last time that mic was very, very low. Right here in the middle. So, Mike, you and I talked earlier, and there were a couple of areas that I wanted you to talk about in terms of the pay plan. One, in terms of those two amendments proposed by approved by the Civil Service Commission, what were the practical implications of adopting those two amendments? Two, what are the practical implications of adopting those two amendments but holding off until mid-year for the actual implementation? And then lastly, I wanted you to talk about employee compensation in the city as a whole, in terms of, we've all heard about, misstep increases in the past and employees not being paid as they should. So I wanted you to give us an overall picture of compensation for our Metro employees. Councilwoman Johnson, did you want to speak before Mr. Taylor? Oh, I got too many mics on.
Thanks. Sorry. I just wanted to see if they could start with what is in the mayor's budget right now, how it is implemented, and why the implementation is so beneficial and sort of as a balancing act from losing the step last year. If you can just explain why it was crafted that way, and because it was really beneficial for me to hear that from Shannon Hall today on why the mayor did what he did the way that he did it.
Okay. Excuse me. Which microphone is
Try that one in the middle should work, I hope.
Okay. Well, Good evening. I'm Mike Taylor. I'm the Assistant Director of Human Resources, and with me is Leslie Schuster. She is our comp specialist. We are the compensation team for Metro in addition to Shannon Hall. So I believe the question about what is included in the mayor's budget, there was a lot of moving parts with this. There was the recommendation from Civil Service Commission, and then what ultimately got approved in the mayor's budget was the 2% COLA for all employees. There was the restoration of step increase or merit increases, which include steps and open range. Steps on average are about 3% for those on the standard range and about 4% for those that are in trades and labor. For the open range, those are individuals that are in professional classification that's really based on performance. That was a total of a 3% pool. Now, with the open range increase, employees, or the departments, are allocated 3% for all the open range employees in that department. So you establish a bucket of money that finance allocates. And within the civil service policies, open range increases basically can go from 0% to 15% based on performance. And that's all spelled out in departments. They submit an open range methodology to the human resources team for us to review. That is sort of what the mayor's recommendation was. The Civil Service Commission had proposed, in addition to the 2% COLA, the restoration of steps for both steps and open range increase, was to add an additional 1% for those employees who missed out in this current fiscal year, those that are on open range, and to grant an additional step. Now, those total proposals from the Civil Service Commission equated to about $6.2 million in which to do that. And the way that it would happen was we would look at employees who missed a step from July 1st of last year to June 30th, who were scheduled to get a step. We would advance them a step on 7/1 of this year. And the proposal also included that when their normal scheduled step date, if they would do one within the next fiscal year, that they would also keep that step. So in essence, it would be to giving those who were due a step, advancing that step to 7/1. Sorry, what were the other questions?
Hold on, Mr. Taylor. I believe Councilwoman Johnson.
Okay, I'm sorry.
So I just wanted to make.
I'm sorry, just to make clarification, I'm visually impaired, so I can't see. I'm sorry.
Gotcha.
I can't see you, so I'm.
Okay.
Okay.
So I just wanted to make it clear that what's in the mayor's budget right now is the step increase, but I think what's important to point out is that the timing of it starts July 1st, which typically it would happen, and correct me if I'm wrong, but typically it would happen on their anniversary date, which could be any date on the calendar of when they started, correct?
That is correct. In HR, we call it DONI date or due next increment date.
Okay.
So it varies. The STEP program, it's multifaceted. Usually if you're on the standard range, you're in the beginning of your career, the steps are annual for general government. And then to get to step 6 and to the top step, which is the 10th step, it takes 2 years. For public safety, police, sworn police, fire, correctional officers, those are 10 steps and they are annual. In the trades and labor, we did do a modification there, but the current plan, if the steps hadn't been suspended for this year, it's a 6 months, 18 months, and 2 years, and there's only 5 steps.
So the enactment in the mayor's budget, with them having the steps begin on July 1st, gets that step to them earlier than they normally would have, correct? So it's a decent balancing act. If you're trying to reinstate 2, this is sort of like a 1.5. Is that sort of correct?
Not exactly, ma'am. What the restoration of the STEP program does, if you would do an increment on, let's just pick a date, August 15th, then you would get your increment on August 15th of 2021. If you were doing an increment on January 15th of next year, which would have been your normal increment date, if the steps have not been suspended, then you would get it in January. What the Civil Service Commission proposed and what we looked at was to prevent some equity issues because there were still employees being hired in during the course of the year. So to prevent equity issues where someone could have advanced that had less seniority than someone else and they had gotten their increment earlier, what the proposal was from the Civil Service Commission was to give everyone who was on payroll as of 6/30 who missed a step to grant them an additional step on 7/1 of this year. And then when their normal increment, so if, let's use the same August date. Someone normally had an increment due August 15th. In the Civil Service Commission's proposal, an employee would have gotten an increment on July 1st of this year, and then their next increment was scheduled for August 15th. They would have gotten their increment then as well.
And that's what's in the mayor's budget now, correct?
No, ma'am, I'm sorry. No, that was in the Civil Service Commission. What's in the mayor's budget is that same August 15th. Whenever your increment date is scheduled, that's when you would get it.
I misunderstood that from Sharon. Okay, thank you. Or Shannon, sorry.
I'm sorry.
The ones who missed get it July 1st.
Not from the mayor's budget.
So the proposal in the mayor's budget doesn't start on July 1st, or it does start on July 1st as far as the step payment?
Yes, ma'am. It starts July 1st.
Okay.
The August was an example, but yes, we do have some employees. It starts with the fiscal year. So if an employee had a due date of July 1st, they would get it July 1st. The August date was just an illustration.
Okay. So if my date is the August date that you use as an example, I'm not going to get two bumps. I just get that one bump on July 1?
That's correct.
Okay.
That's the
Which is earlier, though, than would have gotten.
not the second one.
Right, which is earlier than they would have gotten. So are you getting additional money as an employee with that earlier start?
You get it sooner instead of getting it on your date from.
Okay. But does it?
Everybody who had their increment delayed because of the freeze would get their next increment on July 1st. So they get it sooner than they would otherwise.
So So in terms of the fiscal year, does it still equal out to be the same money, or am I, as an employee, am I getting extra money because it's starting earlier?
It's because you get it more throughout the year because it's starting at the beginning instead of later on in the.
Which was my point, is that it's a step, but for some people, depending on their anniversary date, because they're getting it July the 1st versus August the 15th or December the 2nd or February the 23rd, they're getting it sooner. So it is more money. So I'm hoping that's making sense to everyone. So it's a balancing act of, it's not just a step, it's a step plus because it starts earlier.
Councilman Cash, then Councilwoman Porterfield.
Thanks. I think I'm understanding this a little better, but one thing I'm unsure about is when we're talking about moving the step up to July 1st, is that for this year only? And if that's the case, does that mean that like next year, if we move it back to the anniversary date, that the people who got their money early this year will get it late next year, so that they might, instead of, like, they'll get it 9 months this year, and then if we go back to the anniversary date next year, then it might be 15 months before they get.
Their date of the next increment will remain July 1st.
So
unless they are subsequently promoted into a new classification at some other date, you say later on in March, and then they would reset from there. But their date will remain July 1st.
So we're resetting
Yes.
the anniversary date, basically. Okay, that makes sense, because I was worried if we were just doing it that 1 year, then later on, if they get it early like I said, if they get it early this year, but then we give it later.
They won't have to wait longer for the next one.
All right, thank you.
Councilwoman Porterfield.
Thank you, Madam Chair. I just have two questions. And I apologize if this was already explained. I just want to make sure that I understand that this is clarified. This is for individuals that have missed a step. Is that correct?
It's for the employees who had their increment delayed. So they would have been due to move to the next step in this current fiscal year, but because of the freeze, they didn't, and we reset their dates out, just added 12 months to whatever their date of next increment was. So those people, instead of having to wait until August or November or March, they will all get it July 1st and then move on from there.
So they would be getting, are they getting 2 steps at that time?
No, 1 step.
So this is not giving them anything early. This is giving them something late. Is that correct? Because it was missed.
It's later than they would have gotten it this current year,
right?
Because they were frozen.
Okay,
But
I just want to make sure.
If we did not take any, if they didn't get it July 1st, then they would have to wait until August or November or March, and then the employees that have been hired or moved into new classes this current fiscal year that did not have to wait might pass them in the range. Is why we need to move everybody up to July 1st, and then the new hires would wait a year just like normal, and there's no effect to them.
So if someone, let me ask it a different way. If someone was supposed to get their step November 2020, and they didn't get their step November 2020, but now they're getting the November 2020 step July 2021, is that correct?
Correct.
Correct.
Okay, so it's not early, it is in fact late. So it is in fact us making good on the promises that we have made to our employees. So I asked my colleagues to support this. But my other question was, can you clarify how many steps have been missed over the last 15 years? Do you all have that information handy?
There were 4 years during around 2009, 10, 11, 12, I think, were the dates. There were 4 years where steps were frozen. And then they resumed up until this last year, they were frozen.
So
I'm not aware of any time before 2009 in the last 15, 20 years where they were frozen.
Okay, thank you. So for 4 years they have been frozen. Have we in any way, like retroactively, restored those 4 years worth of steps?
Well, there were some adjustments made around 2016, 2017 with the public safety jobs, specifically police officer 2, firefighter 2, and correctional officer. They were given an extra step. They were the only population then that came as a recommendation from the Civil Service Commission. Those are the only classifications that received anything extra. Everyone else, sort of when the steps were reactivated, everyone sort of started back on the same process.
So thank you for that clarification. So if I'm understanding correctly, our employees that have been working, let's say 15 years or so, who have missed maybe 4 steps, and some of them 3, because some of the public safety individuals did get a step when other people didn't. So the individuals that are missing the 4 steps, if we re-implement this isn't any type of bonus or any type of extra or cherry on top. This is actually us paying what we owe our employees. I want to make sure that I'm understanding correctly and making sure that the body understands correctly. Because I think sometimes there's this misconception that we are giving something special or something extra when in actuality we are doing what we said we were going to do, and we are holding ourselves accountable to the people that are making our city run. So I just want to make sure that that's correct information.
Well, on the surface, that sounds like it would be correct. However, although steps were frozen in those years that Leslie mentioned, there were still opportunities for employees to advance. there was either individuals being promoted or in a number of departments, especially water and police and emergency communications, there's a program called Targeted, in which that has not stopped. The targeting program, since its conception in the late 90s, has not been impacted by any of the economic downturns in Metro. And that is where employees have a time and grade that they must meet. They must meet certain skills. And if they do, then they advance. And usually it's in the same job series, where as you grow from like a 1 level to a 2 level to a 3, you're acquiring additional skills. Individuals or employees did advance. So it's not like there have been no movements at all during those years where there were no step increases. Employees did move. And so it would be sort of hard to go back through the history to see which employee didn't get anything because the majority did. And there was a lot of employees that are probably topped out that once you're topped out, you're not due any increments. So going back over that, from 2009 or a 15-year period, it would really be hard for us to track to see, because like I said, a lot of employees could get promoted or they may have been in classifications where they could target up.
Okay, thank you. So, but we don't know how many employees actually targeted up in the program that you're speaking of. So there were employees that just didn't get the target up and they didn't get the step.
No, once they were eligible for target, they moved. So it's calculated like a promotion that they targeted, and then they hadn't met the year's requirement. Then it's possible then that could have been impacted when there were no step increases. But the promotional process, assuming the departments had the budget, that still continued.
Okay, and Madam Chair, please forgive me, one last question, because now I'm a little confused based on that last answer. So do all employees qualify did all employees target up is what I'm trying to find out. Did every Metro employee target up, or are there Metro employees that did not receive the extra compensation?
Yes, ma'am, sorry to be confusing. We have multiple programs in Metro, so there could have been employees who did not receive a step. But there are also, I don't have the exact numbers, a number of classifications that are eligible for targeting, and that the targeting has never been impacted by any economic downturn. Also, promotions. If someone was eligible for a promotion and the department had the funds available to do promotions, those continued. So employees, did have movement. And not to say that there wasn't some who may have missed some steps during that period, but in order for us to go back and see who, it would be a little bit difficult because there have been movements. And also we have made adjustments to certain classifications as far as pay ranges moving up, during the course of the 12 years since the economic downturn.
Okay, thank you for that information. Thank you, Madam Chair.
All right, Mr. Taylor, during our conversation earlier today, you talked about a Deloitte study and some different things that were put in place in response to that study. Can you talk about that?
Yes, ma'am. The Deloitte study started around 2014 and was implemented in phases. I think the last phase was in 2016, 2017. That was a total look at Metro's compensation. We looked at the salaries as well as benefits. During that time, we found that there were a number of classifications that were what we considered below market, and there were adjustments made to those classifications. We also implemented some new classifications or had some retitling. That was implemented, I want to say about part in 2015 and another part in 2016. Also, Deloitte looked at our benefits. And when they looked at the benefits, they find that Metro's benefits were, as they called it, rich. It was a little bit better than our peers, for all the benefits that we offered. So when you look at total compensation, which is your salary and the fringe benefits, we were leading with our peer cities. But the Deloitte study, like I said, that was the last time we had a comprehensive study. We are looking to implement another one. So the HR staff, we really look at classifications on an annual basis, and where there are classifications that need addressing, it's been brought to the attention by either the department or the various employee groups, or we look and see that there's a particular recruitment and retention issue. That's when we'll look at the jobs, usually on an annual basis, look at internal equity within the departments and across Metro and make adjustments.
Okay, I have in the queue, I have Councilwoman Gamble, Councilwoman Henderson, Councilman Young, and Councilwoman Johnston. Oh, hold on. Councilwoman Gamble.
Thank you, Chair. And just for clarification, I think it was stated that this additional 1% that the civil service is proposing is to catch up on step increases that were supposed to be given last year. So this is not giving them something early. It is catching up on something that was frozen last year. And secondly, the reason for doing this for July 1 is twofold, I guess, so that they don't have to wait until later in the year to catch up, which later in the year they'll be again making another year milestone or whatever, and potentially people who have just started could potentially pass them in their step. Is that correct?
That's correct. The 1%, I believe you're talking about,
Yes.
the additional is for the open range budget.
Right. Yep. Okay.
It's proposed in the mayor's budget at 3%, so that would make it a 4% pool for the employees that are not on a step plan but are in the open range.
Okay. So that would be all of the open range employees.
Correct.
Okay. So that would make their step 4%, not 3%.
Well, the average merit increase for open range would be 4% instead of 3%. And open range increases can vary between,
1 and
0 to 15.
Right. Okay.
Right.
Okay. And the date timing of it
Those are all effective July 1st.
And that is to keep from having other employees, I guess.
The open range merit increases are always July 1st.
Oh, okay.
The step increases typically occur throughout the year on the employee's anniversary date of when they were hired or promoted. This year, many of them will happen July 1st due to the equity issues you mentioned,
Okay.
So that the newer employees don't pass them in the range.
Got it. Thank you for that clarification.
So, Mr. Taylor and Ms. Schuster, with the amendments that were proposed by the Civil Service Commission, if those were implemented, would that cover all Metro employees, or would there be some employees who didn't receive either the extra step or the 1% bump?
That's correct.
That's correct. It would not affect all Metro employees, only if you were scheduled for an increment, a step increment this current fiscal year. And not everyone who's on steps is. If you're topped out, you don't get any more steps. If you are in the upper part of your range, you might be at a step that's only eligible to move up every 2 years. So there are employees who were not eligible for a step this fiscal year, so there was no adverse impact to them. They didn't have a delay.
So do we know how many employees that is that wouldn't be impacted by the?
Roughly, there's about 6,000 employees that are on a step plan. There were about, I want to say, 3,000, 3,100 that had their step delayed. And there are about maybe 1,000 that are at the maximum. So the math on that, about 2,000 employees that were not due an increment. So they will get their next increment on their next date anyway. Mm-hmm. And there was no delay for them.
Okay.
So an extra increment or an early increment wouldn't impact them
at all. Okay. Councilwoman Henderson?
Madam Chair, my questions have been answered.
Okay.
Thank you.
Councilman Young?
Thank you, Madam Chair. The civil service, well, first of all, thank y'all for your patience because we're really getting into the weeds on all this, and there's a lot of different numbers, percentages, whatnot getting thrown around. So maybe someone in the council office or maybe one of my colleagues who's a little better than I am at this could put together a comparison chart that would make it a little easier for some of us to digest. But when looking at what was recommended by the Civil Service Commission, does it seem that there is maybe some inequity between the addition for the STEP employees versus the increase for the open range employees? Because they are both getting more, but it seems that maybe maybe from a percentage standpoint, how does that kind of work out? And I know I might be asking you to shoot numbers from the hip, but
a typical step increase for employees on steps is about 3%.
right.
So if employees got another step, that'd be another 3%.
Right.
The Civil Service Commission, the addition for the open range budget was an additional 1%.
Right.
So as it exists in the plan before the council now, it's the 3% open range budget, which is roughly equivalent
Right.
to what a step is. The additional part for an additional step, which is about 3% or 4% for the employees in the trades. And open range is 1, so not really equivalent.
Okay.
And just for education standpoint, in the past, step increases had continued, and open range adjustments were sort of either stopped or less than what we considered the equivalent. In HR, we consider both to be merit increases. The pay plan dictates whether you're on a step, which is guaranteed, or an old acronym is pay for performance, which we said the departments have the available pool of money at that same 3%, which would be the equivalent of merit increases. So, and to answer, I think part of your question is if we talk about what civil service recommended, it was a full step, but for the open range, it was 1%. So if you're equating both the same, it would have been 2% more, so a total of 3% from the Civil Service Commission, but they recommended, instead of 3 to be equal, it was 1% to sort of give extra incentive, for the open range employees who also did not receive any type of advance other than the 1% COLA that the council granted last year.
Okay, thank you. And have there been times historically where, because I feel like, and I could be making this up, that open range employees have gotten merit or those adjustments or raises and steps did not? I mean, I guess historically, have they always been treated the same each year, or?
Open range has not ever, to my knowledge, had an opportunity to get the merit increases, and steps have not.
Okay.
There have been years where there were steps, but there was not open range.
Okay. Because I guess I have some concern over kind of pitting different employee groups against each other, especially when we look at teachers who got steps last year, who will get steps this year and those adjustments. And so they're really coming out far ahead versus our general government employees. And so I almost wonder, do we need to do a little soul searching on, do we need to do more for the open range employees? Because, I mean, I think the recommendation from the Civil Service Commission will cost an additional, is it like 6.2 million or 6 something million? And we just talked about, prior to this, affordable housing and putting money into it. And when all of us look at the affordable housing projects going up, so many of our Metro employees qualify for the affordable housing. Yet, here we are kind of going back and forth on, is it right to spend an additional $6 or so million to try and help prevent more people from qualifying for affordable housing in the first place? I'm getting on my soapbox. I apologize, Madam Chair, but I guess I support what the Civil Service Commission recommended, but I do have a little bit of concern that are we leaving out some other employees that are the open range employees? And I just kind of throw that out there for us to digest. But thank you, Matt.
Councilwoman Johnston, then Councilwoman Porterfield.
Thank you, Chair. So I was the one that put this in our wish list. And I think that what we've heard throughout all of these budget hearings and work sessions is that there is a ton of need across the entire government. Every department needs more FTEs. We've got capital needs. We've got deferred maintenance. There's just a ton of need. And so I think our job is to balance that. And we also have to consider what is the funding source, because are we going to be robbing Peter to pay Paul? This is a huge fiscal note. It's $6.2 million. After talking with Shannon, I do feel like what the mayor has done in speeding up those steps, making them, starting them on July the 1st, is a good balance. And I also think that the elephant in the room here is this referendum. There's a lot of our county that is very, very upset about this tax increase. And I think we're going to be shooting ourselves in the foot by turning around and saying, hey, we're giving our employees this, huge raise. I also could argue that we hired everyone on these pay plans, that we need to, keep our word. I could argue against it both ways, but at the end of the day, we've got a certain amount of money and we've got a huge amount of need, and we've got to balance those needs with the funds that we have. It took us years to get in this situation where we are so far behind on everything, and it's going to take us years to get out of it. So I think we need to have a very thoughtful process on where we're getting these funds in order to catch up. What are our priorities on doing that? Because we can't fix it all in one fell swoop. We just can't do it. And so with that, I'm going to withdraw my wish list request on this. And I'm hoping that we can continue year after year to try to do things like speeding up the steps, or 1.5, or, there's multiple ways to do it. But I'm just trying to balance out, where are we getting this money? What are our priorities based off of all of the need that we have across government?
So Councilwoman Porterfield also had that on her wish list, and she's next in the queue. Councilwoman Porterfield.
Thank you, Madam Chair. I will not be taking it off my wish list because this is something that's very important to me. I just wanted to clarify, the open range employees, are those typically the higher paid employees?
No, ma'am. We have employees in open range that start anywhere from 40,000 and do go up higher. So these are like your entry-level professionals, the the top 40s. The bulk of it, I think, Leslie, you have some numbers on where they segregate out.
There's about 2,000 employees that are in an open range grade. And like Mike said, they start with your entry-level professional. These are entry-level employees with a college degree, but they start out as like your administrative services officer, probation officers, social workers. It's not just department heads or top management.
Okay, thank you. Thank you for clarifying that. And I'll just be really brief, Madam Chair. y'all know I was a teacher, right? I say it every time we start talking about pay, employee pay, when we start talking about education. When I got hired, there was a chart that was given to me. It was a scale, and I knew every year what to expect in my pay. So I knew for year 1, year 2, year 3, and as I got more experience and I got better at my job, I knew that I could expect to make a certain amount of money. However, what we've seen year after year is that when we can't balance the budget, instead of doing the fiscally responsible thing, instead of being brave and doing what's unpopular, we as a body, not this body, but the bodies before us, we chose to leave taxes extremely low, and we were not able to do the things that we needed to do to keep up with the pay that was needed. So year after year, what we saw was that we balanced the budget on the backs of the employees. And I don't know too many people, other than Metro employees, that would take a job and keep a job knowing that you were supposed to get something and you're not getting it. If you got hired to make $50,000 and your employer said, I can't do it this year, and gave you something less than what you were supposed to get, you would not stay at that job. And we are trying to run a city with people that are hardworking every single day, giving their everything to our city, so that we can continue to run, but we continue to tell them to wait year after year after year. And people are tired of waiting. People are tired of unfulfilled promises. These are our constituents. These are people that live in our community. I get calls from Metro employees all the time that live in my community, and they are not pleased and not happy, and it's not fair that we continue to gloss over them and look over them. So I will keep it in my wish list item, Madam Chair, and I'm going to continue to advocate for it because it's the right thing to do. So thank you, Madam Chair.
Councilman Mendez.
Thanks. I'll try to keep this comment brief. Just in the last 5-10 minutes, we've started doing something that tends to happen this time of year, and that's making over-exaggerated points to try to deliver on your perspective, and I think it's dangerous. And just there's a couple of rhetorical ways of putting things that I think are not good for the community that I wish that we wouldn't do. One, somehow we've normalized that getting a step every year is getting ahead or coming out on top. And it is dangerous to have groups of employees working against each other. But when we talk about people who get their steps every year, whether it's teachers, whoever, that they're quote unquote coming out ahead, the talking point should be people who are missing their steps are behind, as Councilmember Porterfield said, not getting what was promised them, what was due them. And so we should be careful about people in the council characterizing teachers as somehow getting an unfair advantage compared to other employees. I know that's not what the council member said exactly, but that's the way it can come off when we talk about teachers ending up being ahead. And the other thing is about the referendum. Like, we should not create a self-fulfilling prophecy that the majority of the county is upset about property taxes. Most of this body ran overtly on raising property taxes, and we delivered on the promise we made on the campaign trail. I know that's not true for every district, but the vast majority of council members ran directly on raising property taxes. I was the person most closely tied with raising property taxes, and I'm sitting in this seat with the most number of votes. People in this county are willing to pay for services, and that's why taxes need to be increased, and we need to keep doing that. And being afraid of the referendum when we're talking about this budget is the wrong way to go. It's the wrong way to go. We should not be afraid of the referendum. We need to do what's right for the city on the budget and let the chips fall where they may on the budget, on the referendum, which frankly is more about the recall than it is about the tax rate. That's it. Thank you, Chair.
All right. Any additional comments, questions, concerns? For Mr. Taylor, Ms. Schuster, Councilwoman Suara.
Thank you, Chair. I just I may be missing something. Can Mr. Taylor, if you all can just explain who falls in the open range and who is the step? Is it beginners that are open range? Is it people that have been there a long time that are step? And I just want that for clarification.
Council member, it varies. Typically, if you think of your trades and labor classifications, your clerical classifications, those are on steps. Any of your professional classifications, which could range anywhere from, as Leslie said, your general administrative services, HR professionals, finance, research analysts, those are in open range. So more or less those that require a degree typically fall within the open range pay grade. Anything that deals with either clerical or your hands or skilled trades, those are on step.
Okay. And the step are the ones that are guaranteed, whereas the open range is based on performance only. And so you may or may not get it. Is that correct?
Well, everything is based on performance. In order to advance to your next step, you have to have passed your performance evaluation. So everything is based off performance. However, with steps, there's a guaranteed calculation. Usually it's 3% between the steps for those that's on the standard range. On average, about 4% for those on trades and labor. Whereas in open range, it could vary depending on the, like I said, this year, from what's been proposed in the mayor's budget, was a 3% open range funding. And I mentioned earlier, that is, you take all the employees in open range in a particular department, multiply that by 3, and that is your open range budget that is allocated for those employees that are in open range. And per civil service policy, those increases could range from 0 to 15%, but usually departments are, within that 0 to 5% range in most years, when allocating the open range increases.
Okay. Thank you. I don't think I can understand it all today, and I'm sure there's still more to come. So, because when you say people with degrees, I'm thinking teachers have degrees too, but they're STEP. But anyway, so is that determined at the point of your hiring? I was trying to see if there's a mechanism that is it the low wage, when you said people with degrees, is it the people that are low wage or hourly that are in STEP? I was trying to see if I can make any sense of it, but is it even possible?
Well, let's clarify something. For the general government, police and fire, that is not the Board of Ed. We do not do the compensation for the Board of Ed. When you talk about Board of Ed, that's a separate, basically separate division from us. So I'm familiar with the teacher's step. I think they have 25 to 27 steps. In the general government and police and fire, it's different. So we're only focusing in on general government, police, fire, and also the health department. When we talk about steps to open range, we're all using the same pay grade and same methodology.
I think that clarifies it a lot. And so what we're looking at now is a 3% for the STEP, the non-degree, and then a 1% for the open range is what we're recommending.
That is what I think is what is being considered as far as the additional step and the additional 1% that the Civil Service Commission recommended.
All right, thank you.
Councilwoman Henderson.
Thank you, Chair Toombs. Just for community clarification, the Civil Service Commission is a recommending body to whom? So when the Civil Service Commission makes this suggestion to us about the 1%, and that is made or addressed to whom? Is that addressed to the mayor? Is that addressed to our body? Is it addressed to us equally? So kind of from just a process and procedural standpoint, when they make that recommendation, is there a convening of the mayor's office and the recommendation of the Civil Service Commission? They suss that out and then prepare the recommended budget based on that recommendation, or has this recommendation come subsequent to the mayor's preparation of the budget?
Well, it's totally independent. The Civil Service Commission is independent of both the mayor's office and finance. The Civil Service Commission is responsible for setting and establishing pay and pay grades for the classifications that come under civil service jurisdiction. Now, the process normally is that Civil Service Commission makes their recommendation and their proposal. It then goes to the mayor or finance, and from my understanding, which you may have to get legal to chime in on this, I think Mr. John Cooper can chime in. If the mayor or finance can change based on funding, the Civil Service Commission technically is not the body that handles the funding, although we do calculate what the expenses are when we propose a pay plan, but it's up to finance and the mayor and this body to provide additional funding. Now, from my understanding, for the pay plan, once it gets to this body, is usually a up or down adjustment. In other words, once the Civil Service Commission establishes a particular pay grade for a classification, the mayor nor this body can change that. Only the Civil Service Commission can tweak the classification, the pay grade, where that is assigned. Once it gets over here to this body, it's usually a up or down. And usually you're looking at changing the percentage uniformly through all pay plans, either down X percent or up X percent. And I would, from my understanding, that's how, that's the separation of the powers and how it works.
I appreciate that. So by way of an annual process, their recommendation is, I guess, just made public, or they confer with finance in the mayor's office. But I guess what I'm just wanting to kind of understand, and just for the public to understand, this is not sort of a separate or subsequent determination of the Civil Service Commission to recommend this for purposes of the budget. It's just part of their annual recommendation for pay plan processes. Is that correct?
That's correct. The Civil Service recommended the extra step and the extra 1%. And from my understanding, once it went to the next phase, which was the mayor and finance, that part was determined that the funds were not available to do that, to provide that extra $6.2 million. And so that part was carved out from the Civil Service Commission's proposal, but not any adjustments or tweaks we made or recommended to the Civil Service Commission for individual classes.
Thank you. I appreciate the clarification.
All right, any additional questions, comments, concerns for Mr. Taylor and Ms. Schuster? Am I saying that correctly? Yes. Okay. Mr. Edelman, you have the floor.
Just want to make one comment that the $6.2 million also includes water and sewer, which is not in the general funds that you're voting on. So that amount is about $5.2 million. So just wanted to make that clarification.
Thank you. That the $6.2 million, some of that includes water and sewer, which is not part of the general fund. So the actual amount coming out of the general fund is $5.2 million. All right, seeing none, thank you so much, Mr. Taylor, Ms. Schuster, for coming and answering our questions.
Thank you.
And the last thing I have, so that we can end at about 6:30, fingers crossed, expounding on the funding sources, which we will dig into tomorrow. Where's the money coming from to pay for these things? We'll talk about those potential sources tomorrow. But a recurring theme that was in the wish list that I saw was reducing the 4% fund. As you know, the mayor's proposed budget essentially increases that fund to a 5% fund. And so Kristen Wilson is going to discuss what was the rationale behind that, what is that additional money supposed to cover, And of course, that's important to know as we're talking about funding sources, because if you give it to one place, you got to take from another, because it's all got to balance out. So I just want council members to be informed as we're making these decisions. Ms. Wilson?
Thank you. The 4% fund was created in the 1960s. And the concept for it was that all the, I call it working capital needs, light fleet, furniture, repairs and maintenance activities to our assets, IT, hardware and software that are short to midterm, 10 years or less kind of on useful life on average, are funded out of this particular fund. And it's derived from select GSD revenues, includes property taxes, license permits, fees, fines, forfeitures. Created in 1963, it didn't take into account substantial IT costs that we have as an entity. It didn't take into account the amount of equipment or fleet that we might need to run a fast-growing city. And over the course of the years, we've come to enhance our understanding better about the needs of different departments. It's woefully small for what is needed. I think you've heard probably just about every department that relies on fleet in their budget hearings talk about the challenges they have with fleet. I think you've heard just about every department in their budget hearings that rely on equipment talk about the challenges they have with equipment. I'll be honest with you, I think we have some real challenges actually from a safety perspective forming for us, and from a productivity perspective forming for us to keep our employees on the ground out there with their fleet and properly equipped. We're not going to compromise on that. What we're going to compromise then is anything else that comes through as needs on that aren't safety related. So let me explain a little bit further what that means. This past year, because we had a little extra balance coming over from the cost savings initiatives that we implemented in Q4 of FY20, we spent about $50 million this year, $51 million. A good chunk of that went to ITS, about a third. A quarter of it went to general services, which is where our fleet needs are serviced out of. Our fire department received 11% of that. Libraries received about 9% of that. Police received about 5% of it. Parks received about 4%. Going into this year, if we do not increase the 4% fund, we'll have about $40 million, not $50 million. Because again, we don't have the balance carrying over from the prior year like we did, unless we increase it. And that's why we increased it in the mayor's proposal. That increase just kept us at $50 million. And that increase was meant to go to helping us continue to address our fleet needs. It doesn't get us out of the backlog we have fully. It's about a $50 million backlog in and of itself. Our department request that came in for that $50 million was $147 million. So we will be able to fund, if we keep it at $50 million, if you choose to keep it at $50 million, about a third of those requests. And again, what we will prioritize is safety needs. We'll prioritize employee safety, make sure that we're giving employees the equipment they need to do their jobs safely. And what will continue to fall further down on that list will be some of these other departments. Again, as we've discussed and heard, for example, in the libraries conversation, they have about $5 million they seek out of that budget line item for maintenance and repairs of the libraries, as well as for their materials collections. I'll just be clear that we're very challenged to maintain that with the $50 million allocation, and certainly concerned about that otherwise. So we have a fact sheet we put together. I realize it's getting late. We'll get the fact sheet to you. We'll let you know where the expenditures went last year. We'll let you know what departments are making as requests for this year. And I think you can we'll put in some data about the fleet challenges in particular. And then if you have further questions about that as you're going through your deliberations, just let us know, and we'll be happy to share that with you.
As a follow-up to you, Ms. Wilson, or to Ms. Wiggins, are there any opportunities for some of these fleet needs to be included in the ARP funds?
Thank you, Chair. We do believe that primarily public safety and anything related to our health department will meet the criteria. What we really are looking for is the most flexibility we have with the funds and looking into lost revenues. We know that if we can substantiate lost revenues, we will have much more flexibility with fleet and equipment across most of our departments. But until we actually have that calculation and know that we have that flexibility, we're probably really limited to our public safety and public health when it comes to fleet.
Councilwoman Suara.
Thank you. Two quick questions, Ms. Wilson. One, when you're looking at what you spend the money on for this fiscal year ending, IT was a big chunk of it. And would that not be because of COVID and things like that? Are those supposed to be recurring expenses, the parts that IT got out of it?
I'll be happy to clarify that a little bit further. We anything that was COVID related from an IT expense perspective, we look to use the CARES funding for. And so that is not related to that. I do think that IT, a lot of what we addressed with IT was hardware and software upgrades, end of life, end of server equipment for the data center. I think you all noticed we've had a fair number of challenges in keeping reliability, particularly around email. That is because we've had aged equipment in the data center. We still have to address some of those needs, but luckily because we had put some of these dollars into play, the last incident that occurred, they actually had the new equipment on the floor and were working to mobilize it. They just accelerated being able to do that. So anything that has been COVID related, we have, if anything, our IT investments have benefited from our ability to move laptop purchases that typically would have been out of this 4% fund, a lot of the web conferencing investments that typically would have been out of this 4% fund, we pushed over to CARES, and so we had an extra benefit from that.
So what I'm saying basically is that because this is a capital-related long term, more than 1 year, they're not things we're going to need to do again this year, so there should be some savings, ideally, out of that. That was one. And then the other thing is that the 4% is based on the taxes that we have. So in a situation where we have a higher taxes, our 4% this year ideally will be higher than what is calculated at last year. So there should be some room there, shouldn't there?
I think there is a growth of about $3 million. If you actually look, there's a $13 million increase in the budget ordinance. $3 million of that is the organic kind of 4% growth from a higher revenue. And then $10 million of that was the funding we put in to start really working and addressing some of these issues. It's only really an initial step, as well as taking into account the significant amount of staffing that we're increasing. We're going to need some of these additional resources just on the basis of increasing staff.
Yeah. All right, I just want to put all of that out there that I'm sure there's some wiggle room in there, either from the organic growth from the increased taxes or the fact that none of the expenses are non-recurring. I don't know where we're going to end in the conversation tomorrow, but there should be some wiggle room. And I will push back to say that, yes, we need all these fleets and they are safety and we should do them, definitely. But if you don't have the people in place to drive the fleet, then what do we have? So just put that out there.
I respect that, and I will say we are optimizing as much as we possibly can. Whether it's not, this question wasn't the first time this question's been asked of Mary Jo with the fleet. That question actually got asked of the CARES Allocation Committee before, and I see our CARES Allocation Committee members nodding. We chose not to give that funding, and so I don't know that I understand why. I think the priorities at the time were much more significant on some of the aid for individuals and for small businesses. But that was a choice that we've made. And I think that this area has been, I think there's been a lot of choices made over time to put other things as a higher priority. And we've got a challenge in front of us as a result.
I appreciate that. And I look forward to the breakdown of what we had last year and what we're looking at this year. And I'm just looking for some wiggle room. And,
I love wiggle room.
All right, thanks.
Who was it on my list? Councilwoman Johnston.
Thank you. I think it's important to reiterate what Ms. Wilson just said, is that we have challenges. We have a lot of challenges. We have a lot of need. Again, I'm going to repeat that we've got a lot of capital needs. We have a lot of deferred maintenance. We have a lot of need in all of our departments for FTEs. We are running so slim, and it's because of a lot of reasons going way far back that I won't go into. But I think, again, it's really important to keep in mind balance. I'm not interested in taking away from a certain department in order to fund something else. I think that's counterproductive. So I do think that in mind that this 5%, 4% fund is where we should pull from. Should we pull the entire 10 or 13 million? No. And so that's again where you balance and you prioritize and you think long term. We're not going to fix this in 1 year. We're not going to fix it in 2 years. It took us years and years to get here. So let's think about it from, year 1, year 2, year 3, and how we can take chunks out and manage this in a very responsible way, understanding what our funding sources are and what are those responsible funding sources. Taking from another department, in my opinion, is not the way to do it. The 5% fund, I don't know any other fund to pull from. And we don't, contrary to popular belief, I guess, we don't have a money tree. I missed the memo. We don't have a money tree. We don't have unlimited. So let's figure out what we're willing to pull from. What is that dollar amount? And then prioritize need. And when you have run through that amount, let's say we decide it's $5 million. When you run through that $5 million, that's it. Next year, let's take another chunk. Next year, let's take another chunk.
So I will say I'm looking around for other hands. There are other funding sources other than that 4% fund. And I will share those with you tomorrow. I want you to see how I want to spend it first. Before you. Councilwoman Henderson, sorry.
Thank you, Madam Chair. Ms. Wilson, can you clarify the $147 million in request for current 4%? Is that in its entirety, or is that specific to fleet? Or if you could maybe zero in a little bit on the fleet requests, and whether through the document that you've prepared for us or here, help me understand when you speak to safety. So that's a very general term. And so are we talking about vehicular safety? We're talking about the tires, the life on something like that. Because, as I drive my Honda minivan into the ground, I'm just going to keep driving that. But I know, there's maintenance requests and so forth. Obviously, we want every employee in a safe vehicle. But I wonder, too, if we're looking at this brand of vehicle only has a life of 10 years. Or, should we be, I just wonder if our kind of life horizon on our vehicles and how that's equated with safety. I mean, obviously, when you're talking about, helicopters or, things, that are going to fall out of the sky or something like that, that kind of goes to another place. But can you speak to the safety concern particular to fleet and what exactly that means, please?
Sure, happy to. So I guess to your first question, kind of overall, how does the $147 million break out? Over $50 million of that is fleet. And that's light fleet again. We do have a heavy fleet challenge as well that is more appropriate for the CSP, CIB discussion. So I want to be clear about that. The light fleet, again, you'll get this in a further fact sheet. Just think over 50 million. I think the number here is 53 million is essentially the backlog we had even before we add a single additional new staff person. Think about that. That number is in that 147 million as the fleet number. On top of that is additional fleet needs for the new staff. Fire and ITS also are probably the next highest level departments after general services. They're each coming in around 15 million this year in their requests, again, not including fleet. Fire will have things like turnout gear for our firefighters. When that gear expires, we have a safety issue, right? And so that has to be replaced. Specific equipment that is used in fire, that's where safety will come in. So what we will do is take each one of these requests and put them through a lens. and evaluate them and ask them to be prioritized. Departments have prioritized their requests already, as they do every year, based on kind of where they see the greatest need. But we're going to actually go in with a different tier and say, go back through your list, pick out the things that you think go to employee life, health, safety, and re-rank them. And those will be the things that we make sure get funded. Does that help?
Very helpful. Thank you.
Director Crumbo.
Thank you for recognizing. Is this on? Yeah, thank you for recognizing me, Chair. So I want to provide a little clarification here because a lot of the comments that I'm hearing here, most of them are correct, right? But you're at a crossroads here of some accounting and finance concepts that I think are really important to recognize. And I really want to compliment Ms. Wilson on pointing out that the 4%, as we know it today, is a very old concept. And she's entirely correct that it was put in place, I don't know what the logic was. It was done 2 years before I was born. But in today's world, we've got a lot of capital needs. And she's entirely correct that the capital we have is wearing out. And it may be IT needs and things that are more familiar today. It could be fleet and some of the things that I've heard mentioned. But 4% is really talking about capital, right? And we have two very familiar sources of funding for that. We have the 4% that we're talking about here, which essentially comes out of an operating budget and is made to look like something operating, but it's really capital. The other way we do capital is to do a capital spending plan. Either way, at some point, you as a council will be approving the money for that because the equipment's going to wear out and have to be replaced. So whether it is here in this operating budget and whether that amount goes up or down, as Council Lady Suara very correctly pointed out, it could be a little higher, a little lower because it floats based on the rate, or whether it comes through a capital spending plan, which ultimately we here fund through commercial paper and on through bonds. Either way, we're going to pay for it. So it's now or later. I would encourage everyone to really think about that before we get to the session tomorrow, because what Kristen is talking about is really important. This equipment need is not going away. In fact, I'm surprised the number that she's been thinking about isn't actually larger. In fact, I know it's going to be larger at some point. She's doing her very best to make it skinny and digestible here in this budget, but at some point, we're going to need to pay for all of that. So hope that provides a little clarification, because I was hearing a lot of folks that are very right here, but you're at a crossroads of accounting and finance concepts. Either way, we're going to pay for it at some point. So I hope that helps.
All right, any additional questions, comments, concerns about the 4% fund? All right, not seeing any hands. Are you a hand? Oh. That's right, you were reminding me that you wanted to speak on something. Councilwoman Suara.
Thank you, Chair. I just want to make sure before we close the meeting that I made a clarification with regards to the fire department. I was referring to an audit report and talking about personnel. I think I was mixing things up. The audit report that I was referring to did not specifically talk about having few people on apparatus. It was talking about review and some other things. The area where the having 3 instead of 4 came from the questionnaire from last year budget session, where the chief was saying that they go out with 3 people instead of the recommended 4. I think it's very important, because when we talk about audit, when we talk about compliance, I don't want to put anything out there that makes it feel like as if they're not doing something that they're supposed to do. That's not it. That's not there at all. It was a questionnaire from last year. They've got additional FTE this year. That will help with that. I know they're still short by 21 FTEs, and I'll be glad if we can give them those. But just want to clarify that it's not related to the audit. Thank you.
All right, anything additional? All right, tomorrow we will be looking at the going deeper into the funding sources and the proposed allocations and the substitute at 4:30, same place. Good night, y'all.
This has been a service of the Metro Nashville Network. If you would like to see this presentation again, or for more information about this and other programs, visit nashville.gov.